No more bad breath, disease warning. Come on, first stretch out the back of your hand, lick the back of your hand with the middle and back part of your tongue, not the tip of your tongue, then wait for about 10 seconds. Smell the smell on the back of your hand. Do you smell a smell? Sour smell? If so, then unfortunately, it probably means you have bad breath. Many people don't know they have bad breath, thinking that it's just because they are angry or because they don't brush their teeth diligently enough. Some people have particularly strong bad breath, and brushing their teeth several times a day and using mouthwash still doesn't improve. Finally, they seek medical advice and are diagnosed with nasopharyngeal cancer. Caused by tongue cancer, may be a warning sign of physical disease. It is recommended to find out the root cause and treat it to improve it. Identify diseases by smelling breath. Rotten apple smell. Ketoacidosis. Possibly diabetic ketoacidosis. Ketoacidosis mainly occurs in patients with type 1 diabetes or those who often forget to inject insulin. When diabetes causes ketoacidosis, there is often a sweet taste of acetone that smells like rotten apples. At this time, please seek medical treatment as soon as possible to avoid life-threatening danger. Ammonia flavor. Kidney failure, dialysis patients. Dialysis patients, kidney failure or kidney disease patients are unable to excrete toxins, such as urea nitrogen, from the body and accumulate in the body for a long time. The patient's mouth will exhale a smell similar to urine or ammonia. In addition, certain psychological diseases can also cause bad breath, such as anxiety, insomnia or certain mental illnesses caused by autonomic nervous system disorders. Garbage smell. Tooth decay, periodontal disease. Up to 90% of bad breath cases are related to periodontal disease and tooth decay. Patients suffer from inflammation of dental plaque and periodontal tissue. A type of bacteria called anaerobic sulfur bacteria in the mouth produces odorous bacteria after decomposing nutrients. The concentration of sulfide increases, causing the rancid smell of garbage. Sour and sour smell. Gastrointestinal digestive diseases, gastroesophageal reflux. Gastroesophageal reflux refers to the excessive secretion of gastric acid, which causes gastric acid to flow retrogradely from the stomach into the esophagus in the mouth, causing damage and inflammation to the esophagus and oral mucosa, and causing the mouth to emit odor. Patients with Helicobacter pylori infection or patients with poor gastrointestinal digestion are prone to having food stay in the stomach for too long, resulting in a smelly and sour taste. If gastroesophageal reflux is in the third stage, the cardia can hardly close, and gastric acid can burn the entire esophagus, and precancerous lesions have even been seen in the esophagus. Smelly feces. Liver failure. In patients with liver failure, as the metabolic capacity of the liver weakens, its ability to decompose toxins will also decrease, resulting in an increase in blood ammonia levels in the body, causing a slightly sweet odor of excrement in the patient's mouth. Fishy smell. Sinusitis. Sinusitis is mostly caused by infection, allergies, dust in the air, etc. irritating the nasal cavity, causing swelling of the nasal mucosa and obstruction of the openings of the sinuses, causing a large amount of secretions and bacteria to stay in the sinuses. Over time, it turns into pus. At this time, when bacteria are added to decompose these dirty things, a fishy smell will be produced. Previously, a 60-year-old woman felt that her sense of taste had changed significantly and she could not feel the sour taste, so she went to the hospital for examination. She had a putrid sour smell in her mouth. It was discovered that her vocal cords were not moving very much, and it turned out that she had terminal lung cancer, which had even infiltrated her bones. Lung cancer is among all cancers, the disease most likely to cause abdominal tumor syndrome. It will cause changes in sodium ions and calcium ions in the body's positioning, shaking the taste system. Therefore, if you find that your body has some special odors, such as changes in breath or taste, you should be careful, cancer may be coming to your door.